Do you have a knee that pops? If you have a knee that pops, you may wonder what causes it and if it's a sign of something serious. And those are the questions that I'm going to answer for you in this video, as well as some tips that you can use to stop knee popping and stop knee pain if you have it. Now, if you find this video helpful, give it a like and subscribe to our channel. We're dedicated to helping people stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So first of all, what are the things that can cause a knee that pops? And we're going to discuss two main categories of that. One that is internal to the knee joint and one that's external to the knee joint. And then there's kind of a middle category, which I'll explain in a little bit. But first of all, what are the things that causes internal knee joint popping? And by that, I mean the joint between the lower leg and the upper leg, or the tibia and the femur. That if you have something inside of that joint that's grinding, for example, a torn meniscus or knee arthritis, it can cause some popping sounds. With a torn meniscus, you might even get like a locking where your knee won't move, and that can be really scary. But if you're just getting popping sounds and you're not getting locking and you're not getting any pain from your knee, then it's probably not a really big deal. Now, if you are getting pain from your knee and you're getting some of those popping or clicking sounds or grinding sounds if you have arthritis, and you wonder what you can do to stop the pain and stop the clicking, basically the things that cause that internal popping of the knee are grinding the two joint surfaces together. Particularly if you have arthritis where the cartilage or the meniscus has worn down and you're grinding basically bone on bone or very thin layers of cartilage on bone, that twisting of those two non-lubricated surfaces can cause a grinding or a popping sound. And so if you're getting that, you want to minimize the things that cause that twisting between the joint, that cause that grinding or popping sound. And largely your knee is a hinge joint. It's just really supposed to move primarily in two directions, but it does have a little bit of side-to-side movement as well as twisting and rotation movement like that. Now, when your foot's planted on the ground, that side bending like that and the twisting and rotation, they're kind of coupled. So those movements happen together. And the most common cause of knee pain in general, but that popping sound that's inside the knee, is this valgus movement where your knee goes in like that. And it causes sort of a bending sideways like this, as well as a twisting and rotation inside the knee. So how do you prevent that? Well, largely your hip muscles are responsible for controlling that movement. It really has not very much at all to do with your actual knee joint. It has more to do with the hip muscles, because that's the part of your body that controls the rotation of the leg, is the muscles in your hip. And so you want to do exercises to get the hip joint stronger. Now, one of the best functional exercises you can do is just standing on one leg and trying to balance without a whole lot of twisting or side-to-side movement like that. You may have to hold on to something if you're just starting, but you want to get to where you can balance pretty well like that. Now, if you get popping going up and down stairs, then the next step would be to do little bends of the knee while still trying to maintain it and not get a whole lot of that side-to-side movement. So that is a solution for the grinding and popping inside the joint. Now, what about the things that cause grinding and popping on the outside of the joint? And popping on the outside of the joint is really the more common problem. It's the problem that a lot of people have, whether you're younger or whether you're older. There's also kind of that middle category that I had mentioned earlier. So that external knee joint popping is caused usually by one of two things. By your IT band, which is a long sort of tendon or fascia that runs along the outside of your leg, by it going over the outside bump of the knee as you bend and straighten your knee. If you get popping primarily when you bend and straighten your knee, particularly if it's around this 30-degree bend level, like right around there, like when you take a step or when you go up and down a stair, and particularly if you feel the popping on the outside of the knee, then that's the most likely cause of it. And the reason is that IT band, it runs down the leg and attaches right there on the knee, just below the knee on the outside. And as you bend your knee, it kind of runs behind the knee joint. as you straighten your knee, it runs in front of the knee joint. So as you bend and straighten past about 30 degrees of bending, it rubs back and forth, and it can get irritated, something known as IT band syndrome or runner's knee, because runners are going back and forth like that over and over and over for miles and miles on end. So that popping on the outside of the knee can be due to IT band syndrome. It can also be caused by the kneecap. And that's oftentimes related to IT band syndrome because there are fibers of the IT band that go into the kneecap. And when it's stiff, it can pull the kneecap to the side. Now, your kneecap normally sits in a little groove in your thigh bone. And as you bend and straighten your knee, the kneecap moves down and then it moves back up. Moves down as you bend, moves back up as you straighten. And normally, if it's running right in the center of that groove, there's not a whole lot of noise that's associated with it. But if it's off to the side and it's kind of pushed along the outer side of that groove, then you get that popping sensation as you bend and straighten your knee, particularly if you have weight bearing on it, like going down a stair. Now, some people have a really, really shallow groove, or they've torn a ligament through an injury or something on the inside of their knee that normally helps hold the kneecap centered in that groove. And if that's the case, occasionally people will get a kneecap that dislocates. It actually pops out of place. And that is incredibly painful when it happens. Sometimes it just goes right back in. Other times it actually stays out and you kind of have to pop it back in manually or have someone else do that so that you can get the knee to unlock and you can move it again. Now, after you've done that the first time, it can become a little bit unstable. And it's really important, again, to maintain that neutral alignment of your hip, like I mentioned before, because that keeps the groove from going in this way while the kneecap goes out that way. So the same sort of solution, the controlling the motion of the knee and being able to balance on one leg and go up and down stairs or squat on one leg is really important, even if you have a kneecap problem. But sometimes if your knee pops out of place, you need a little bit of extra help. And they make some braces that they go around your knee, and it has a little stabilizer right here. I'll put a link to a good one that I like on Amazon. It's called BraceAbility, but it has a really good pad that helps hold your kneecap in place, and it keeps the kneecap from going to the outside. It's not just one of those sleeves that you buy at the drugstore. You also really don't need one of those ones that has the bar. The main component that you need to be concerned with a knee brace for a knee that pops is a little C-shaped thing on the outside that helps keep your kneecap from popping to the outside. Now, what other things can help a kneecap that pops or a knee that pops? Well, regardless of whether it's an internal problem or it's an external problem, again, the big things you want to control are that side-to-side movement. So a big factor that people have who have knee pain is stiffness in their ankle joint or stiffness in their calves. That if you take a step, you need to be able to move your body weight over your foot. And if you have a stiff calf muscle or you have a stiff ankle joint, you're not able to do that. Now, your body needs to be able to get where it's going. It wants to be able to get where it's going, so it finds alternate pathways around that. And the most common pathway that people find, the most compensation that's used to compensate for that problem, is something called pronation, where your foot flattens, your knee goes into that inward position, and again, it can grind the internal joint surfaces as well as make the kneecap go towards that outer side of the groove. So stretching your calf muscles is a really good thing to do if you have a knee that pops. And I've got other videos on how to do that. I'll link to those so you can get a better reference on exactly how to stretch your calves so that your knee doesn't go in and your kneecap doesn't pop. But sometimes that's not enough. Sometimes you have to do other things with the ankle joint. If it's actually an ankle joint problem, you may not just be able to stretch the muscles. That if the muscles can't get to a stretched position because the joint is too stiff, you need to do other things. And largely that's where manual treatments through physical therapy, mobilizing the joint, or in some cases doing like a popping of the ankle joint, can help loosen that joint up quickly so that you can stretch and do the other things that you need to be able to do to keep that calf flexible and prevent that pronation. Now, if you have flat feet or if you have weak hips, orthotics can also help if you have a knee joint that pops too much. that orthotics prevent your foot from flattening, again, kind of helps prevent that inward motion of your knee and can help keep your knee from popping. Again, both whether it's an internal problem or whether it's an external joint problem. And there are some over-the-counter insoles that I recommend for people. One, a brand that is good for people with moderate to low arches, and other people that I recommend for another brand that's good for high arches. And so I'll link to those products as well. Now, what else can you do to help a knee joint that pops? Particularly if it's an external knee joint problem and you're going downstairs, if you put your weight on your toes or you have your knee going really far forwards when you're going downstairs or when you're lunging or when you're squatting, if your knee goes in front of your toes or really far in front of your toes, it can create a lot of compression behind the kneecap, and that can cause popping or a grinding sound if you have arthritis in the patellofemoral joint, meaning the joint between your kneecap, the patella, and the femur, your thigh bone. And that's kind of the intermittent category that I was talking about. The one where it's not really the knee joint itself where it bends, but it is inside the joint behind the kneecap. And so that behind the kneecap joint problem can be helped if you don't use as much of your thigh muscles and you use your bottom muscles more. Now, the way you can do that is keeping your weight more on your heels as you're doing things like squatting. Instead of keeping your weight on your toes and going down like that, you want to keep your weight more on your heels and sit back so that you're using your hip muscles, your glute muscles or butt muscles more and your thigh muscles less. The less force you have to use from your quadriceps or your thigh muscles, the less compression there is on the kneecap or the joint behind the kneecap. So that's one solution. The other one is that when you're doing lunges, you also want to keep weight on the heel. Or if you're going downstairs, I've got another video that shows this a little more in specific, but it's really hard to keep your weight on your heel as you're going down your stairs. But if you hang the ball of your foot over your stairs and you just kind of let it roll over, that will help a lot if you have that popping of the knee as you go downstairs. And I'll link to that video for more specifics on that. So I hope you found these tips helpful. If you do need some help for knee pain or knee popping, or just to figure out what's wrong, if you live in the St. Louis area, we'd be happy to help you out. Just give us a call here at More for Life. And if you found any of these tips helpful, regardless of where you're watching this from, leave a comment letting us know this, and give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks so much for watching, and have a great day.